Good afternoon, everyone. My name is Vishal, and I work for 11 Thrive as MLA lead in India. We would like to thank conference organizers for providing us an opportunity to present our implementation research experience, especially our work on strategic use of program data as system strengthening measured for maternal nutrition. Other contributors for this paper are Praveen Sharma, Dr. Sevanti Ghosh, Thomas Frazier, all from 11 Thrive, and Ali and Dr. Jose from IPE Global. Lancet series and data from Demographic Health Survey have shown that maternal nutrition, a long-standing concern globally and in India, despite knowledge of proven affordable intervention, a comprehensive package of MN services is not reaching most pregnant women. 11 Thrive undertook effort to strengthen the delivery of MN services, including counseling through the government antenatal care platform in Unnao and Kanpur Dehat districts in UP. Our approaches were system strengthening and SBCC. Within system strengthening, one focal area of support was use of routine data during sector and block level review meetings to improve program performance. NT worked towards following buckets or streams that include implementation team working with frontline worker towards improved quality of routine HMIS data. This included review of HMIS data for inconsistencies and submission of error-free data on portal. We have also seen several fancy dashboards for top-level program reviews, but are these dashboards have ever been used for sector or block or district level reviews and resulted in any appropriate actions? NT used routine HMIS data to develop block and subcenter level maternal nutrition scorecards. These scorecards, along with other program data, were used for discussion and program reviews at sector and cluster level meetings. NT also worked towards strengthening supportive supervision through capacity building of supervisory cadre on MN and supportive supervision process, provided them ODK-based checklist and handholding support during the supervisory visits. Key themes and gaps in counseling discussed between supervisors and frontline worker on the field and also in the various sector and cluster level meetings. These measures helped in identification of priority areas for improvement to close gaps in service delivery and counseling. Strengthening the supply chain of IFA and calcium tablets, which are MN commodities, was also another key focus where NT worked for demand estimations, indenting the right quantities, tracking stock positions, supporting procurements, and streamlining distributions. Technical support to strengthen data-driven decision-making included orientation, capacitation of government frontline supervisors and block-level supervisors, guidance notes and handholding support, HMIS-based monthly scorecard, and dashboards to visualize HMIS stock availability and supportive supervision visit-related data during block-level health reviews. As mentioned earlier, 11 Thrive actually developed maternal nutrition scorecards at block and subcenter levels that included 11 relevant indicators from HMIS. These cards were used for discussion with FLWs at sector and cluster level meetings. Color codes red, yellow, green were used to visualize performance of MN indicators on a monthly basis for various intervention blocks. System strengthening work resulted in activity use of routine data in regular review meetings. Total 237 health and ICDS supervisors from 13 blocks were capacitated, and every month 13 block level health review meeting and 77 sector or cluster level review meetings of health and ICDS with an achievement rate of 100% were activated for using data for program review. There are encouraging results from evaluation done by IFPRI, that demonstrate that higher use of data during AAA and cluster review meetings, also higher exposure to and use of MN block cards and checklist. Also, more supervisor exposed to supportive supervision checklist data and reported using this data for sharing feedback during sector or cluster review meeting. Key uses of MN block cards among ANM and supervisors included identifying area of progress and also data from supportive supervision checklist used by ANMs and supervisors to discuss quality of MN counseling, identifying topics with high quality of counseling and topic with low counseling. Use of data shifted focus to MN service coverage, better supply chain, and error-free HMIS data. However, there were difficulties in understanding data quality, and lack of time as expressed by FLWs and their supervisors. Towards the end, I would like to highlight that strategic use of program data is critical for decision making to support facilitated action and provide targeted supervision and support for improved performance of FLWs. Active engagement of block level management team and supervisors generated ownership and facilitate the use of routine data on regular basis. Structural barriers such as staff vacancies, especially of supervisory cadre, could be addressed, and also we may move away from a culture of fault finding to a culture where there is value given to data use for improved performance. Thank you.